and we can get started. So welcome everyone. This is session 2 of managing nonprofit financial operations as part of the Nonprofit Basics series that Peer Recovery Center of Excellence is offering. Someone just told me that our other host, Stephanie, is going to enter the room. So there she is. Okay. Give me just a second. I'm going to let Steph take over.
Yes. Hi. Good afternoon.
Hi, Steph. It's just about to get started. Making you a co-host.
Perfect.
All
Thank
right.
you, Tiffany. Yeah, sorry for the delay. I'm traveling, so wanted to make sure I had a space to check in with all of you today. So without further ado, we'll go ahead and get started, and whoever is comfortable advancing slides, please go ahead. So thank you for joining us today. This is the part 2. And a quick disclaimer, this initiative was made possible by a grant from SAMHSA. And so the views expressed and written within today's presentation, speakers and moderators don't necessarily reflect the official policies, but you're still in for a good time for sure. So next slide. All right. And so we want to acknowledge the fact that language is incredibly important. And if we want addiction destigmatized, we need language that is so unified, and making sure that we are cognizant of that fact and leading with kindness and empathy with the individuals that we're serving in our respective areas. So making sure that caution is taken, especially when the disorders we're talking about are so heavily destigmatized as mental health, substance use disorders, and so on. Next slide, please. So today you're going to learn a lot from Amy, who is fantastic, and I can't wait for you guys to hear from her and get to do a little homework and group work today as well. And so before we do that, I want to let you know about the Peer Recovery Center of Excellence that I work at. So does Cindy, and we also provide TA. So if you have any technical assistance that comes up, after this presentation, maybe you want a resource, maybe you want to look at a report, maybe you would like to connect with another group or organization, especially if it's in, the recovery ecosystem. So we're happy to connect you. It's super easy to submit on our website. One of us will get back to you, and then we'll create a plan for delivering your TA. So you'll have all of that information set up along with deadlines, if there's any subject matter experts that we need to kind of loop in. To help make sure that we can deliver it. And then we always, hope for feedback, good, bad, and different, and make sure that we're meeting the needs that you have. And so respond to a survey for that, for sure. Next slide. Thank you. So some housekeeping before we get started, right? The little voice already popped up saying presentation is recorded. So we are here, we are ready. Please make sure to mute yourself whenever our presenter is speaking, myself or Amy, and if she has another person coming on with her as well. What's helpful for us is to identify who we are and the work area that we're in, so that we can make sure that others can recognize you as well, and can network, especially in the chat. So if you haven't yet, please go ahead and put your name, your organization, and maybe what you're looking forward to getting out of today's session. So feel free within that chat box, go ahead, submit in questions, comments, feedback, whatever that looks like, because myself and Cindy will also be monitoring that. And I'm really quick on, if there's websites and other resources within the Peer Recovery Center of Excellence that you seek. So I'll make sure to stay very active in there. And do know that after this takes place, we will go ahead and send you the slides for this presentation. So feel free to sit back, observe, do whatever's best for you. And then since this is our second section out of 2, you will actually get an evaluation link, and that's how we help ascertain, like making sure that you get your certificate of attendance and things of that nature. So please do fill that out within a couple days. And then, that was perfect. Go ahead. You are on top of it. And then lastly, today we're going to delve into financial management and how to effectively oversee financial operations. So this is the fun, nitty-gritty aspects. And slides from the first day were emailed, I believe, in the first follow-up one, but I have no issue making sure that you have access with it for this one too. So no problem with that. We will make sure that you get your slides, because it's a lot of good content. So I want to connect you back to that information. So overall learning outcomes, we're going to learn about foundations and importance of nonprofit finance, and how peer-run organizations can really maximize their effectiveness and sustainability when making those financial decisions. And so you will discover the importance of operating a nonprofit with a specific financial focus. We will help you understand how to read balance sheets and make decisions. I know a lot of people were asking for that, so we're happy to provide that for you today. We're going to recognize how nonprofit RCOs, so we'll say that quite a bit, which just stands for Recovery Community Organizations, how professionals and RCOs can utilize financial operations to really promote sustainability. And then lastly, to understand the importance of data and building capacity for peer-run organizations. Make sure you guys can run smoothly. Next slide. Wonderful. So here we are. And without further ado, I'll go ahead and give it over to our speaker to walk through the rest. So thank you all so much. And I'll be in the chat if you need me. Go ahead, Amy.
Thank you, Stephanie. Thank you, Cindy. Hello, everybody. It's nice to see you again. Glad to be here. As you recall, we met on May 2nd and did our first session where we covered the introduction and the level setting, as well as our homework assignment. So as you can see on the screen, we have some new agenda items this session, and we hope that it's helpful. First things first, we definitely want to do a recap. So kind of we covered a lot in our last session. So if you recall, we all shared our names, organization, and roles with each other last time in the chat. So like Cindy said, feel free to put that in the chat if this is your first time joining, or if you just want to let everybody know, who you are, where you're calling in from, where you're zooming in from, please do so in the chat. We definitely welcome that. We also covered level setting, where we talked about the RCO needs assessment. As you may recall or may not recall, because it was a couple weeks ago, funding was the top need identified at 82% responding RCOs identifying this as a need. Focus groups revealed that all interviewees had expressed inadequate funding and insecurity about future funding. Very few RCOs have healthy diversified funding streams according to that RCO assessment. Also identified was high burnout rates due to lack of sustainable funding, staffing, and training. And there was an apparent national RCO underfunding issue, which is kind of why we're here. So this is the Peer Recovery Center of Excellence's response to some of those assessment findings. Part 2, we talked about optimizing recovery funding, where we learned that in volume 1 of the report, the Peer Recovery Center of Excellence looked at RCO's responses nationally and identified challenges and ways that funding is allocated to fund organizations for recovery support services. Federal grants, we found that federal grants can be highly complex, and existing funding streams often have restrictions that limit utility for RCOs to provide recovery support services. These were the findings from the Recovery Community Organization Survey. Both community and government stakeholders noted the need for clear reporting requirements and standardization of data reporting. And some of those recommendations included federal and state funding agencies should provide flexibility, and called out the need for funders to fund the entire portfolio of recovery support services, specifically for community-based organizations, to help reduce the administrative burden for RCOs. Great recommendation. I can't underscore that enough. We also looked at state of the states. So we took a look at NASHBID's Division of Recovery Support Services survey, where multiple identified diversified funding streams were available. States identified a number of different partnerships, as well as different types of recovery support services. So for example, 44 states and territories got the survey, 19 states responded. Of those 19 states who responded, 20 different types of recovery support services were identified, targeting 12 different populations, and 12 different state agencies and stakeholders were identified as being partners in those statewide recovery support service implementation efforts across 8 different funding streams. That was a lot of information. That was a recap. What we could do, Cindy, if you don't mind, if you could put the link in the chat So if you guys remember on our last call, somebody had asked about what those different state agencies and partnerships were. And I didn't necessarily have the information off the top of my head at that time, but the link that's going to go in the chat is the full survey response. So you guys can take a look at that on your own if you'd like to. The different types of recovery support services identified were peer drop-in centers. I'm just going to recap briefly. Peer drop-in centers, recovery organizations, peer support, employment support, education support. Some types of the recovery support services partners identified were community mental health centers, employment agencies, Department of Corrections, state health departments, jails, child welfare, DCS offices, or Department of Child Services, primary care, state hospitals, juvenile justice, and victim services. And just to reiterate why those different types of partners are important to note is because those different partners also come with funding to the table. So if those are different identified partners in the implementation of recovery support services, each of those that are state agencies specifically come with funding. So those may be opportunities for funding recovery community organizations. Then we also talked about the White House updates, the SAMHSA Office of Recovery work. And then, as you probably recall, we had a homework assignment, which is where we're going to go next. So we had asked you guys to find 1 to 3, and we actually provided some examples to get you kickstarted on the homework assignment. But we asked you guys to find 1 to 3 current grants that are available that your organization could qualify for based on an identified need or goal of your organization. So we wanted you to find 1 federal grant, 1 state grant, and 1 local grant. So we asked you to come to the next class prepared to share 1 goal or outcome of your organization that you work for, as well as share the identified grants that you found that were most eligible for RCOs. And we wanted you to be ready to talk about some barriers, successes, questions, insights, and aha moments that you experienced as you were looking for those grants. So we just did the homework review, so we will move on. So what we would like to do now, I think we have, how many people do we have in right now?
Not counting us, there's 14. So let's do 4 breakouts because not everyone may join. We hope you do though.
Okay. So for better conversation, what we would like to do is break out into 4 small groups of 3 to 5 people. Cindy and or Stephanie will be pulling you guys into those groups. It will be random. We just want you to share with each other for about 15 minutes what the challenges and successes were. If you weren't here last time, feel free to listen in and or weigh in on the conversation based off of experience you already have looking for grants. Every person in this small group or in the breakout should have a chance to share. So please try to make sure that everybody has an opportunity to share. We want you to identify 1 spokesperson for your group, because when we come back to the larger group, we want to have a report out of what your key takeaways were, what your key aha moments were, maybe just what you learned. We really just want to hear as a group what the key takeaways were from your homework assignment. So group questions to discuss, just to kickstart the conversation for you guys, are listed here on the screen. I don't know, Cindy, if we can copy and paste these into the chat for everybody so that as they're in their breakouts, they have them. That would be great. I don't know if somebody has access to that. If not, we can do it as soon as you guys go to your breakouts.
Yeah, I don't have your slide, so I can't copy it from the screen, but I usually encourage people, if they have their smartphone, to take a picture of the screen.
Okay.
If
And
that's possible.
I'll try to copy and paste.
Copy it. Okay.
Guys, yeah. Once you guys,
Okay.
since I have the PowerPoint pulled up on my end, it should be simple. Before we do breakouts though, does anybody have any questions?
We do have at least 1 person that's in a setting where they can't speak right now,
Okay.
probably at work.
Okay.
So no worries.
Yep, no worries. So in the breakout, just whatever group Carolina goes to, Let's just make note of that. And if you can, just try to use the chat to weigh in.
Okay, we're gonna allow for 15 minutes, right, Amy?
Yep.
Okay, so you'll get a warning, I think, with 60 seconds left, and then it will just rip you back into this room. So I'm gonna open the breakout rooms. You'll just have a little button to click on your screen to say okay, and you'll be off. I will also check and make sure that there's at least 2 people in each room and you're not sitting there by yourself. So hang tight once I send you off, okay? There you go.
And I did
So
get
Amy and Lindsay, I did leave you in the main room here, but you're welcome to join the others.
I might try to hop
Yeah, you
if
can,
possible.
yeah, or I can place you. Okay, Trevor. Looks like he's alone. Oh, no, there's another person with him. Okay. Carolina, you're gonna stay here with us. Or feel free to jump in and listen. Mercedes and Emma. Okay. Okay, well, all the rooms have 3 except for room 2. Oh, there goes Emma. Now they have 3. So Mercedes, you might be on your phone or something, but you are welcome to jump into a breakout room.
I think I'm going to jump in just so I can hear them, if that's okay.
Do you have a preference, Lindsay, what room you want?
Nope. Do you guys have a preference of which one I go to?
Not at all. Sorry, I had a barking dog.
That's
Very
all right.
loud barking dog. Are
Okay.
you able to pop yourself in, right?
Yep. I'm going to go
Okay,
ahead.
good.
I'll pick room 2 because that's a 3-person room.
Okay.
So can I, so where I'm at, am I able to just join whatever room I want and then come back and then join
Yep.
another room?
Yep.
Perfect. Are you guys comfortable with me just?
Oh yeah, I've got the timing down. We left at 12:18, so 15 minutes or 14, I'll close them. Did that work, Lindsay?
For some reason it sent me in and then it kicked me out.
Uh-oh. Let me try sending you in. Okay. Whoa, Lindsay, where are you? Doesn't even say you're back. It still says you're in there, Lindsay. That's weird. Okay, wait.
Oops.
I'm gonna move you to room 3 because that's all it's
Okay.
gonna let me do.
Carolina's saying that she's in a room and there's nobody there.
I only have 4. I mean, I have Carolina. She's got room 3 where I just
Oh,
sent
she said
Lindsay.
nobody's talking.
Oh, okay. Yeah.
But it
Okay.
says she hasn't joined.
I know. I'm gonna text her or I don't know.
I'll try to join room 3 too, because that's where
Okay.
Lindsay went.
Here,
and
I'll
let's
just
see what
send you,
happens.
let me send you there. Assign
Okay.
to room 3. You can pop out whenever.
Okay.
Okay. I'll talk to Carolina.
And we could also pause the recording too.
Yeah, I actually, thanks for remembering that.
Yeah, no worries.
Where did my recording go?
Hello, Lindsay. Sorry about that. You got
That's okay.
good too. Well, welcome back, everybody. We hope you had a great time catching up. I don't even think in our group that we got our reporter identified, but I'm sure we'll figure it out. So let's see here. Let me catch my bearings. So what we would like to do now is let's do a homework review. So hopefully everybody got to identify somebody from their group to report out. And so I know at least from our group, some people weren't able to do the homework, and or this was their first time, or they missed the last session, or for various reasons. So we kind of went off the cuff with some of our responses. But Cindy, how many groups did we have? 5? 4. So, and the groups were numbered. So maybe we start with group 1. And did somebody get identified as a spokesperson?
So that Carolina, Julie, Mark, Robin were in room 1, I believe.
So were you guys able to have a good conversation? Does somebody want to report out for the group? And if somebody didn't get called out, does somebody want to volunteer?
Go ahead and unmute and jump in.
Our group, we were just talking about the grants that we have and what we're doing with them and the restrictions on them, or what we could do, what we couldn't do, in a sense. The other 3, I think my organization's the smallest because we operate 6 days a week all year long, including holidays, and we run on $193,000 a year. That's all we get. And with 1 full-time employee and several part-time that take on the rest of the tasks. So, and I am the executive director, so I basically have to not only apply for, report on grants, but I have to do everything else. So anybody else in the group want to jump in? And I was not here last time.
Sure. Yeah, I think everybody has some sort of level of federal grants that they've been operating on, and I'm sure everyone's sort of monitoring things that are available. In our case, our executive director does that. I'm actually on the board of directors. I'm the treasurer. But so our main funding comes from federal grants, but we've also been able, I'm in New Hampshire, so we've been able to get money out of a large charitable foundation and some smaller local groups. There's like 100 women people who give away money. But local is harder. And we have gotten state money. Most recently, we're getting state money, which is really the opioid money that's being filtered down. But and I'm relatively new with our group, but our executive director does not like dealing with the state people. They're just even more difficult than the federal people to do that. But so and then our other, I forget whose name it was, who's in Texas, they have a big transportation grant, which sounds like it's filtered from federal to Texas transportation. And then they have like 38 drivers or something, which I wasn't clear on that. I guess they're driving buses around, taking people around. But so I think we were more reporting about things that we've been doing rather than looking for new things. But I know we monitor, things that we hear from within the recovery community, especially in New Hampshire. We all like to share, what money is out there, and then we all go chase it. So, and hopefully we all get some.
Mark, I'll say I definitely want to hear more about that Texas transportation initiative, but I will say that you're not the first person I've heard about that struggles in New Hampshire. So we just did a webinar it was last week actually, with Promise Resource Network and Kiva Centers, and Shireen Carrico had shared about the peer respite that's happening Oh, wait, I take that back. That was North Carolina. I digress. Although New Hampshire does have some amazing peer respite. But no, let's hear about, so the Texas, who was reporting out for Texas?
That was me, Julie, from a Rural Economic Assistance League. We have a multi-program nonprofit. One of the main programs is a transportation. We provide transportation in rural areas. We cover over 9,000 miles, 9 counties. We look for funding as in ways that we can provide access to those that cannot afford transportation to the urban areas, which in our area would be.
No, I know, but it's because the contract already.
So what we do, we look at programs, we were able to get
You want to go ahead and go.
as a sub-grantee program through another transportation company, which is the CCRTA, which is Corpus Christi Regional Transit Association. They gave us $100,000 in order to transport people in the rural area to the Corpus Christi
Sorry.
urbanized area. So they're able to get a discounted rate.
But yeah.
They subsidize those fares. Instead of charging $10 to get from Alex to Corpus Christi, it is now $2 one way. So that helps them out. Gets us to their medical doctors and whatnot. And
So you can get the other one.
like I said, I'm sorry, I know everyone
I'll send it to you.
is talking behind me.
Yeah, I'll
I'm
send
in
it to you.
not a very good work area.
Yeah.
Um,
It's okay.
okay, and is there any questions? I'm sorry.
Well, Julie, so here's what I would say is that if you don't mind sharing your contact information in the chat, I would love to have an offline conversation with you and just learn more about that, because we have some national rural efforts happening that I think could learn a lot from what you're doing.
Okay, sounds good.
Thank you.
Yeah.
All right, group 2. Do we have one spokesperson, or how many people were in that group?
Hi, it's Jamie. It was myself, Brian, and Emma. Emma couldn't speak at the moment. Brian and I, neither one of us were able to attend the first session. So, and neither one of us have any experience with searching for grants or writing grants. So we were just having a discussion amongst ourselves about, how do people learn how to search for grants and write grants? Some colleges and universities don't even offer those classes. Luckily in Michigan where I'm at, I will have the opportunity to take a class like that. But I know a lot of these webinars, seminars are helpful. And we were talking about how learning how to differentiate between the different nonprofit statuses. The nonprofit that I'm currently working with is a 501(c)(3), but I know there's so many different levels and kinds. Also, how the org I'm working with is trying to streamline our finances and get everything converted to electronically so that we can produce better reports for when we are ready to write for grants. And we also are trying to fight for some of the opioid money that is being dispersed to each state and then trickle down through each county. And we're on the low end of the totem pole in our county with the services we provide. So we'd be happy with anything at this point, but we are attending all the meetings. So I don't know, Brian, if there's anything I forgot. We're just happy to be here. Thank you.
Yeah, I do. I agree with that. We're happy to be here. And I think part of this, from my experience, because during one of my internships, I was tasked with finding grants for the organization that I was at. And part of it has to do with that, having a clear definition and understanding of the services you provide. And then beyond that, kind of draw a blank. I could find grants. I mean, Google is your friend, right? So just looking for federal, state, and local grants, especially when you're dealing in the areas that I have experience with in terms of substance abuse and opioid abuse. There's lots of money out there. There's lots of grants. It's almost overwhelming. There's so many of them. So finding a federal, local, and state grant that addresses substance use disorders can be difficult for myself, in my experience, only in the sense that there's so many out there that how do we, I mean, it's not realistic to apply for every single one because there's just too many. It seems, I get the feeling that SAMHSA in particular has just tons of money, and it's the pools of money for, especially with the wave of fentanyl overdose happening. It seems like there's so much money, there's so many grants. How do we pick one when there's hundreds out there or more, you know? So yeah, that's, again, we're just happy to be here.
No, that's such a great point, Brian. And I think that's great feedback that the Peer Recovery Center of Excellence can take back to SAMHSA, because I think you're spot on. Because how do you identify the best possible grant that you would most likely qualify for, right? And then because you invest all of your time and effort into one grant and then you don't get it. And it's deflating. And so I think that's such a great point. Great feedback. Great feedback.
Yeah. I mean, we because the university in the town that I live in doesn't offer grant writing classes. There's no real opportunity for us to bring on any interns with that kind of experience. Finding a grant writer in New Mexico, it is difficult because it's a niche, a sort of niche experience that not everybody has. You kind of have to learn on your own. They don't offer classes or degrees in grant administration, so it's just this huge field of question marks everywhere.
And I did have a quick question. So when we're able to write for grants, hopefully sooner than later with my org, would we list like the services that we do provide, even though we're all non-billable, and then also the services we wish to provide? That's why we're seeking why we're seeking funding.
So I will share that I worked in state government for 5 years and I was on a lot of grant reviewing committees in my time in state government. And we did look for that, because one of the things that SAMHSA grants as well as state grants are very adamant about is that we're not looking to supplement, or I should say, we're not looking to supplant existing funding. In other words, if you're already getting funding to provide ABC services, we don't want to come in and pay for what you're already doing. You're already getting grant funding to do that. So if you can illustrate for the grantor, whoever you're applying the grant funding from, if you can illustrate what you're already doing, it shows that you already are qualified enough to provide these services because somebody else gave you the funding, but then also show the need for the expansion and then what you're going to do with the expansion dollars. If you can find a way to illustrate that within the grant proposal, that is always ideal.
Okay, great. And then the funding that we have, that the entire way that the Alano Club operates since 2001 at our location has been purely donations. There has been no grants. So that's why we're trying to learn how to swim in the grant world.
Yeah. And we're going to get into some more of that. I think some more tips and tricks for you, hopefully, I think in the next few slides. And then if you weren't here last time, just know that we also have a a list of possible non-Medicaid funded grant opportunities that we're aware of. It's not a all exhaustive list, but it's a start for those who are interested.
Okay, wonderful. Thanks.
Okay, how about group? I think I was group 3. Or was I group 3, Cindy? Help me out here.
You are, yes. I have Amy, Haley, Lindsay, and Nyla were in room 3.
So does somebody from our group want to report out? Because I don't want to just hear from me. I know we didn't identify somebody. Lindsay, do you feel comfortable doing that? Kind of putting you on the spot last minute.
Yeah, that's totally fine. We didn't get very far into all of the questions, but I can kind of frame up what we did go over. In terms of the grant success and barriers, a couple of us did not really have experience, or that was not the job description, so there wasn't too much to say. I do have a bit of experience in terms of grants that I've just recently kind of dug into over the last 9 months with my new position. And we were just talking about how some of those barriers for me personally wasn't so much the grant writing itself, but the mindset I had on a personal level towards it, in terms of thinking, oh, well, I won't be able to do this, or, oh, this is going to just seem so hard and so impossible, or thinking that I needed to reach outside of my values to accomplish the job. And as soon as I started letting those fears kind of fall to the wayside and was reaching out to people who I knew would give me the correct advice, encouragement, and help, things really started to turn around. And right before we got cut off, one of the major points I was trying to make about that whole process in terms of barriers and success is that no matter what, grant writing does not have to be a barrier at all, or a success or a failure. Even if you end that grant and you don't get it, all of the pieces that you learned and took on and the relationships you built and reaching out and asking for help are such a huge asset, and they will play deeply into your next grant writing and your next grant writing. So what may start as not getting the grants is still a success, because you are literally on that journey of learning and getting all of those pieces you need to present and write a grant that does get the green light.
Spot on. Thank you, Lindsay. Anybody else from our group want to add any additional things to note beyond what Lindsay shared? Just looking through my notes here. The other thing I would add is that the folks that were in our group weren't necessarily the grant writers for their organization. So that was a key takeaway from ours. And so we had talked about the need for capacity building opportunities for wherever you're at within the organization. So, all right, group 4, you're up. Last but surely not least.
Yeah, Barbara, Daryl, Mercedes, or Trevor.
I don't know that we really set a speaker, but I took some notes. So,
Thanks, Daryl.
yeah, Trevor was really our one of our big speakers. So if I miss anything, I hope Trevor will jump in. But we talked a lot about how our organizations were constantly, while we're funded, and in Trevor's case, pretty well funded by the state, his organization spends a lot of time looking for special funding for special needs. And that's for, the state funds things, but they're fairly specific about what they will fund. So if you're trying to get outside of their little area of what they're funding, you got to find the funding for it. And from that, we kind of went down the path of talking about more local funding versus writing grants. And what we talked about was how to focus your messaging and the importance of, or at least the niceness of having a community-based funding initiative, how that can really help with that. And we also spent a little bit of time talking about the importance of diversification.
Is that diversification of services offered or funding?
Funders.
Oh, okay. No, that's spot on. That's signs of a healthy organization right there. Okay. Anybody else from group 4 want to weigh in?
Yeah, Dell, thank you for stepping up and sharing those thoughts. I just wanted to add a couple of quick points. Don't be afraid to collaborate with other organizations applying for monies at any level. I think communities demonstrating partnerships sometimes carry a lot more weight than one individual. We've had some success in doing that, and most of the bigger grants we've gone for historically have been stronger because of those collaborations, although we think we're just great by ourselves. And there have been grants that we did not get. And one of the things we discovered, just to piggyback a little on what Lindsay had shared, every application is a learning opportunity. We've asked our funders, we've gone back and we said, can you please tell us why we did not qualify for this grant? And interestingly enough, we've been told at least 2 times, no one's ever asked us that before. And they invited us to sit down at the table and go over our application, literally section by section, and say, this is strong, this is not, you didn't answer the question well here, here's how you could have done better. They want to help, believe it or not, because they want to give money to organizations that understand the goals of the group or entity that's providing the funding. So that's something I'd recommend if you don't get the first grant, or even if you don't get any grant, reach out for that clarification.
No, that's so good. Thank you, Trevor. I will say that I'm even guilty of not doing that, of reaching out and asking why. It's just like, oh, didn't get it, on to the next one. And that's such a mistake, because it's a learning opportunity, just like you said. Okay, anybody else from group 4? Yeah, that's totally true, Robin. There will be times where they don't tell you why. You're spot on with that. But I still don't think it hurts to ask, for sure. Any other feedback? So let me, and I know we're kind of over the 10 minutes we had set out for this, and that's fine, because I feel like I'm learning so much just hearing you guys share. So this is open for everybody, any group, any participant. This is a question that's open for anybody. Did you learn something new from hearing other people share today that's helpful to you? Has anybody picked up anything new that is going to be helpful for you moving forward? Me too, Jamie. I've got a couple notes written down myself from every group.
I have not really. I've been doing this for 22 years, and I've heard most of what I've heard. We're very, we've been providing mental health support for most of those 22 years, but in the past few years, we've really ramped up our support for people with substance use issues too. And I've been to grant writing classes and things like that that are offered by our state support organization. However, it's still a huge challenge. And I find that SAMHSA grants are not easy to apply for and get.
Yeah.
Over the years, I mean, I'm the only one that is really doing any of the grant writing. I write the grant and then I send it to several members, board members, and other executive directors of agencies doing similar things to review for me, and they come back and usually have very little correction except for maybe 1 or 2 little hints or grammatical things. But it's very discouraging. As I said earlier, we run on $193,000 a year, which means I cannot, I can't pay my peer specialists what they can get if they go to another organization. And, grant writing is only one fraction of what I'm responsible for. So it's very difficult when you have a small budget.
Mm-hmm. No, you're spot on, Robin. And I'm sure you've got so much wisdom, you could probably facilitate this whole training. It's not even a training, it's just facilitating the conversation at this point. You're right, it's complicated. Yep, I agree with that too. So here's some key things that I took away that I'm actually going to carry with me into future conversations. The comment about no grant writing classes in New Mexico, I think that's a solvable issue if states are aware of the need, and we can kind of push that nationally. And I also think that the too many grants from SAMHSA in particular, that it's hard to understand which one you qualify for. I think those were the two things that I definitely noted and put a bunch of extra stars next to. I know that with SAMHSA's Office of Recovery, they're still onboarding people. They have another new director. I know that they're doing a lot. I have a whole new Word document from one meeting last week on new stuff that they're working on. And hopefully some of these issues are things that they can address and or encourage states to address. So, all right, so let's move on from our homework review. Thank you guys for participating. April's joining. So we are going to kind of switch gears here. And we're going to talk a little bit, and I know that some of you indicated that you are not the grant writer for your organization, nor do you have a lot of experience and or expertise in this space. So I don't know that balance sheets might be your forte, but I still think it's a good learning curve, and this isn't all we're going to cover. So just hang with us. We'll try to move through this as painlessly as possible for those of you who this may not be helpful for. But we wanted to just cover the basics. Balance sheet. So what is a balance sheet? So a balance sheet is something, and I think Lindsay, who I've invited to share here in a little bit, is going to speak to this too. But I myself have struggled with a balance sheet, which is why I asked Lindsay to come, because I've watched her kind of grow through her own process of learning. And so I'm looking forward to hearing her tips and tricks for what she's learned in the process too. But first things first, let's just describe what a balance sheet is. So a balance sheet is a financial statement used by a business for insight into its financial standing and overall value. It records a summary of the business's finances, including the assets, liabilities, as well as the owner's equity. Balance sheets are important accounting tools for small businesses because they not only provide a snapshot of a business's financial balances at a given point in time, but can serve as key indicators of potential growth and or decline. So what is included in a balance sheet? To create a balance sheet, you'll need to collect all receipts, invoices, and other financial documents to record your business's finances. Using a chart, you'll then record this data in one of the three sections: assets, liabilities, and equity. Going to minimize chat. So if I miss anything important, somebody please stop me if we need to stop and answer a question. So assets are items of value that the business owns. Some assets can increase the overall value of the business, as there are items that can be sold or used to make products. Assets are classified as tangible and intangible assets. So tangible assets are physical objects that can also be categorized as fixed assets, meaning they are not for sale, but rather used for operational purposes. Intangible assets, meanwhile, are not physical objects, but concepts or ideas of value, such as intellectual property. So liabilities, let's talk about liabilities here for a second. Liabilities, on the other hand, are essentially debt to the business. This is what the business owes to other businesses, employees, or customers. Liabilities are divided into two categories like assets. However, the categories for liabilities are current and non-current. Non-current are debts that are considered long-term, and current liabilities are debts that must be paid within the year. So equity is considered the net worth of the businesses and is listed after liabilities and represents the amount that would belong to the owners of the business if all assets were used to pay off all liabilities. We're going to send these slides out to you as well. So we're going to go through these next few kind of quickly, I know, but you'll have these as a reference. So once you understand what goes into the balance sheet, you can begin to create it. So feel free to use, like I said, feel free to use this PowerPoint as a guide after the presentation if you need to. Note that there are also lots of templates and resources available online, as some of you are aware, but there are some basic tips listed here as well. You'll want to determine whether you'll be reporting for the month, quarter, or the year. Gather all your financial documents, fill in amounts for the assets and liabilities, then determine retained earnings or equity, and make sure you fill out both sides of your balance sheet. So once your balance sheet is filled out with all the necessary financial data, you can begin to analyze the data. Balance sheets offer many insights, including a company's net worth. One way of looking at it that may help it make more sense is here. So here you see the debt ratio is used to determine the financial standing by determining debt using the formula that you see here. Debt ratio equals total liabilities divided by total assets. Then you have working capital, which refers to the funds used to cover operating costs and can be calculated using the formula that you see here. Current assets minus current liabilities. Debt to equity ratio shows a business's leverage regarding its capital and whether the majority of its debt or shareholders' equity is calculated with this formula, total liabilities divided by total equity. So here is an example of a balance sheet. You'll see all different kinds of balance sheets. I've sat on a number of local and national board of directors, and I've seen some very comprehensive multi-sheet and Excel spreadsheets and visuals, and I've seen a lot of various ways balance sheets are kept and tracked, but this is a very basic balance sheet example for you that I'm hoping you are in the process and or in the future going to be developing your own balance sheet. We want you to leave with at least a visual example. And so now I get the pleasure of introducing our guest speaker today. So I actually sit on the local Recovery Cafe Lafayette Board of Directors, and our Executive Director, Lindsay, who is here with us today. I've watched her struggle and grow significantly in her role as Executive Director, particularly with the financial side. And so I had asked her where the mission is to support the development of the mind and body of spirit. It says my internet connection is unstable, so I apologize if I'm breaking out. I might turn off my camera. So Lindsay worked as a peer case manager and operations manager at Home with Hope, a recovery residence located in Lafayette, Indiana, whose goal was to create health, home, community, and purpose in the lives of those experiencing substance use disorders. She also worked closely with Phoenix Recovery Solutions when they first launched, helping to provide multiple pathways to recovery solutions through peer-based services and lived experiences. She has been certified with her Certified Addiction Peer Recovery Coach 1, Certified Recovery Specialist certification, as well as medication assisted treatment training certification since 2018, and is consistently striving to help people navigate their recovery journeys in Tippecanoe County and the surrounding areas located in Indiana. So Lindsay, without further ado, I'm going to pass it to you to share some tips and wisdom, and you just tell me when to change screen.
Definitely. So I'm grateful to be here today, guys. I started my role with Recovery Cafe Lafayette just about 9 months ago. And when I stepped into that position, I thought it was extremely important for me to be incredibly transparent about what I did well, what I did not do well, and what I had never done before. And I think right there set a precedence for everyone to kind of know where I stood, and also allowed me to be open and honest in the areas that I needed to reach out and ask for help. One of the biggest assets that I have been able to keep in moving forward through this position is not being afraid to look stupid and not being afraid to reach out to anyone under any circumstance to make sure that I thoroughly understand what's going on. You know, a lot of times if things seem new or hard or difficult, a lot of times you kind of isolate yourself at the fear of people thinking less than or thinking you're less than. But utilizing your team, utilizing your staff, utilizing your mentors or your board is really going to set you ahead. And just don't ever be afraid to ask for help. I'm kind of wondering really quickly, how many of you are dealing directly with financials in your position right now? Robin? Okay. And are some of you guys on here because the potential to deal with finances are in your future? The balance sheet that I made and the budget versus actuals that I made, I tried to keep extremely basic because I know when I'm trying to wrap my head around something, it is definitely in my best interest to keep it simple. I also think that it's really important to always offer a resource. So I do have a website to offer you guys. I am going to post that into the chat once I'm done so you can refer to it. It is extremely helpful in terms of breaking down definitions and making things make sense. And then I will also leave my email. So in the event that you have a question or just need to reach out to someone, you know, as a friend or just someone to, you know, bounce ideas off of, you guys have that opportunity and can use that whenever you're in need. So the first thing we're going to start with is the balance sheet. Again, I kept this incredibly simple so you could look at it very easily. And to kind of go over a couple of things that Amy had already mentioned, I just want to point out that the balance sheet out of all your financial statements is going to be very black and white. It's going to be extremely clear. It's going to list your assets and your liabilities and your equity, and it's going to be super easy to read. Like Amy had said, your assets are going to be your income. So things like such as your grants or your bank accounts. Your liabilities are then going to be what you owe or pay out, such as payroll or taxes. So if you look at the balance sheet in front of you, it starts with the assets and goes down a couple of lines. And in that assets area, you can see that we have listed Purdue Federal Credit Union. Can anyone explain to me why that bank would be listed under the assets?
Is that where CDs or the savings accounts are?
So the bank account is associated with the savings, but because it's under the assets, that is showing that that money belongs to us. That is a part of our income, which is why it is on that line under assets. So you can see that our bank account has $149,418.62. That belongs to the cafe. So that's why it's under the line item that it's under. So then if you keep moving down under assets, you see accounts receivable. And if you look over, that is in the dollar amount of $8,750. And can anyone tell me again why that amount of money would also be listed under our assets?
Because that's what's coming in, that's what you're receiving.
Exactly. Great answer. So of those assets, we have two listed, our bank account and the amount we receive, which happens to be from a grant. So those two numbers are then taken and added up. And if you look under those next line, that is where we get the total of $158,168.62. So then if we move on from there, you can see that those next line items are coded as liabilities and equity. So when we think about our liabilities, again, those are things that we are paying out. Those are things that we owe and have to take from our income. So under there, we have listed Visa Business. So that's a credit card. Obviously, we owe for that. And that credit card was for $1,220.64. And then we also have listed our payroll taxes in the amount of $3,222.66. And then we have the taxes payable under that as well for the state and local in the amount of $611.99. So if we take all of those liabilities and we add them up, it brings us to the line item of total liabilities in the amount of $5,055.29. So then if we take all of those total numbers and we add them up completely, we get a total of 1,058, 168, or I can't read it, 168.62. And that final number of the assets and the liabilities combined is what gives us our total liabilities and equity, which shows what we have as an organization. Does that make sense or seem confusing?
That makes sense to me.
Okay, now obviously, you know, the more income you have, the more assets you have, the more liabilities you have. These balance sheets and all the financial statements have the likelihood to start seeming very overwhelming, because if you're anything like me, numbers kind of jumble your mind. So I always suggest, if you can afford it, having an accountant to work with is extremely helpful. But in the event that you don't have that, I always suggest using a platform such as QuickBooks. That platform allows you to pull those reports so you can look at them in an easy manner. And then if you're not able to even afford something like QuickBooks, even using something like an Excel spreadsheet to keep yourself organized and paying attention to all those things are definitely going to benefit how your numbers look and are. And it's also probably going to alleviate a lot of your stress level in trying to deal with them. Do any of you guys have any other questions about balance sheets before we move on to the budget versus actuals? Okay, next slide. All right, guys, so the picture on the right that is more black and white is the one that we are going to be going off of. And I know that the font is small, but I will try to just give you more of an overview to make it make sense in your mind rather than go through each piece. The budget versus actuals is a great way to make sure that you are either on point with your finances or not. They are always set for a specific amount of time, just like your balance sheet. There might be some organizations that look at a budget versus actuals for a whole year, but a lot of times I think it makes more sense to be looking at that on a monthly basis. But no matter what, when you're dealing with your finances, they should be a daily thing. I'm continuously logging our receipts and subtracting from our income and making sure that things make sense. You know, when we get new grant funding, say in the amount of $10,000, we don't just throw that in the account and forget about it. You know, we spent a significant amount of time taking the amount, dividing it into 12 months and coming up with a budget for those months. So our finances continue to work in our favor. So the budget versus actuals is extremely critical. It is most likely the one you will use alongside your balance sheet to make sure that you're on track. If you look at all of the columns, there are 4 different columns, and that first one is the actual column. This is your income and the money that you actually receive and have on hand. The budget column, which is the next one to the right, is the budget or money that you plan on receiving. The next column where it says over budget, that is the column break down what you did or did not receive. So if you start at the very first column, you can see in that actual area that we have $8,750 of actual income. We actually have it. But then if you move into that next area where it's columned as budget, those first initial lines break down our income. And so when we did a budget of our income, we expected ourselves to receive $24,249.99. So because we only got the $8,750, and we compare that to the over budget column, which is next to our budget, when we add up all those line items in the over budget, you can see that we only hit about 15,000, but there's a negative there, which means we did not get those funds that we thought we were going to get. We budgeted for them, they didn't come in. So now instead of being over budget, it shows that we are under budget for our income, which is not necessarily a bad thing. when you're dealing with grants, obviously you don't want to be under budget too much because, you know, when you get that grant funding, you need to be able to spend that. But in terms of your income, if you are under, you don't really see the outcome of the spending until you start to get into your expenses. So because of the fact that we were under budget, $15,449.99, that shows that we are still under budget by 36% of the budget that we actually received. If we keep going down on the line items, we start to get to our expenses. Now, this is where the actuals column starts to only read zeros, and the budget column of the expenses do have numbers there. Those numbers are put there because, again, that is what we have budgeted in. So for instance, our marketing, you know, we have a certain dollar amount there, or for our payroll, for our salaries, those have been given very specific dollar amounts. So we have a budget in place that fix and go over what our actual finances are. But then if we look at our actual spending in the next column next to those expenses for over budget, you can actually see that those are still all negative. So for whatever reason in this month, we had a budget for our expenses, but then when we look to see if we were over or under budget, we are still under budget because of those expenses and have not met all of those thresholds. So our expenses add up to being $13,702.08. But the next column where it says over budget shows that we had no expenses. So it shows again that for our expenses, we are under budget by $13,702.08, which is actually good. Obviously, it's always going to be better to be under budget or on budget for expenses rather than being over. Then if you go to all the way down to the bottom where we're looking at our total expenses, which is the last three bold line items, it says that our total expected income or budget was $24,249.99. So that's what we had projected our budget to be. So we take that and we subtract it from our total expenses. So if we add up our total expenses, that dollar amount equals $19,030.83. If we take those two numbers and we subtract them, that then leaves us with a total of $5,219, which is 167.65%. So once you have that last total number in your percentage, the way you figure out if your budget versus actuals is on point is you take that number and you times it by your percentage, and you're going to want to get the total of your actual income of $8,750. I know that is a lot of information at one time. So if any of you would like me to go over that more or thoroughly explain it, I am more than happy to do so.
So if an org is not showing that they're able to spend what they're bringing in and say they're accumulating some money in their savings, are they more likely to be denied for grants because it's like, well, you're not spending your money?
So over the course of a long-term amount of time, that could be the case depending on the person that's going on the grant. However, it's important to remember with your financials that they are going to ebb and flow. So for whatever reason, you may have a month that has expenses that go over your budget. But then you might have a month where things kind of pan out. So to give you an example, when I first started at the cafe, we had a certain budget that we could spend for each month. But when I first started our position, we immediately went independent from the people and the entity that was over us. So in doing so, that brought on a lot of expenses that were not normally in our budget. You know, we had to pay for emails, we had to pay for insurance, there was more staff brought on. So while we were taking on those new expenses and trying to fit them into our income, our balances and our budget versus actuals did start to look a little different. But a lot of times, so long as you are in those numbers and making sure they do make sense and line up, those numbers do end up working themselves out.
Okay, because for our current situation, purely donation based, so
Mhm.
struggling most of the time, barely so-called making ends meet. But with some of the one small COVID relief grant, been sitting on it just in case, because we're purely donation, even though we're trying to transition to obtaining grants. And I just wondered if that would hinder any grant money approval if it showed there was $10,000 sitting.
Sure. A lot of times those questions can, I don't want to say difficult to answer, but they can be all over the map. Each grant that you get has different reporting guidelines and has different expectations. So you really want to make sure that you are versed in the information provided by the grant to make sure that you're spending how they want. A lot of times they want you to do different reporting and financial tracking, but if you just owe that final report at the end of the year, it might be perfectly fine if you still have it now, but that could potentially change towards the end. I know for us, in the event that we do have an overage, we sit down as a team and decide, what are we really in need of? What is something we could add to the cafe space that would truly benefit us, because we are in a moment right now where we have some extra funds, and then we're still able to deplete those funds in a manner that does fit within the reporting guidelines.
So I noticed that we're down to about 5 minutes left, because I think we end at 2:30. And then Robin, you had your hand up. So do you want to come off mute and share?
Yeah, I will say that in my experience, if we do not spend our money that is given to us by grant at the end of the fiscal year, they want it back. They're not going to give us more. They're not going to give us more. They're going to say, you didn't need it, give it back to us.
Yeah, and that's usually the case. We have a coalition grant right now, and we've used very little of it, but our goal was to save it to really come up with a bunch of ideas as we moved into our new space. So we will make sure we have used up all of those funds in the correct manner by the deadline, but you definitely always want to reach that deadline.
Mark, I see you have your hand up. You're muted.
I turned on my video, but all of our grants, it's very important. The ones I've been involved with, it's important to the grantor that we're going to become sustainable. If they're giving us money for this year or over a period of 3 years, where are you going to get the money to keep the program going after that? So I wouldn't think it would be a negative that you have a pot of money. We're probably about $500,000 nonprofit, and you probably have more money in donations than we do. We're terrible at this kind of individual fundraising.
Mm-hmm.
I just had one other thing before we end. We were talking about learning about grant writing or where do you get help. We've got something in New Hampshire called the New Hampshire Center for Nonprofits. It's like a nonprofit for nonprofits. And I get their email all the time. They list jobs with nonprofits, but they also have classes. And I was just thinking when we're talking about, they have a class coming up. It's a 3-day course on grant writing. As a member organization, it's $300, and you got to spend 3 days there. But I would imagine that you all have something like this in your own states that could be a resource for helping with some of these issues. And I also just want to mention, I since this thing began, I've reached out to some of the bigger RCOs that have been involved with this. Like there was Georgia one earlier on, and asked for help from the people who were on the with some questions, and they were extremely helpful. And I think these big organizations have way more experience, resources, can help you with looking for grants, or I was asking about managing grants actually, and I got some great feedback. So just wanted to throw that out there.
Cool.
No, great point. Lindsay, thank you so much. And I noted that Lindsay did put her email in the chat. So if anybody wants to reach out to her directly, and just following up on what Mark shared, I will share that each state and territory, the majority of states and territories have an Office of Recovery or a similar type office in their state mental health authority. So if you are not aware of an organization that can help you figure out how to write grants or get technical assistance, I would contact your local state mental health authority. And then I will share that we were going to cover a whole data section, and I just want to share this, and then we'll send out the PowerPoint so you guys have it. I know we've got about 1 minute left, but I did want to share that SAMHSA is working on a national recovery research agenda. And so one of their guiding principles, I think is what they're calling it, is on data and research. And so I just want to point out that there is a SAMHSA block grant data change request that is open for public comment as we speak. So any organization that is receiving state funding that is block grant specific, that could impact what types of data that you have to collect. So it is open for public comment if anybody's interested, and you're interested in the policy level. Just note that it is open. And so I know it's 2:29. So I want to give Stephanie and or Cindy the floor for any closing comments to make sure we cover anything that needs to be covered.
Yeah, I just wanted to say thank you all so much for joining us today. Please keep an eye out for our email, and also look at the link that Cindy has provided below that has the recording slides, resources, etc. And also please, in that email we sent out, fill out that evaluation form, because we always appreciate your feedback. And while I was, capturing, your comments and resources shared, shout out Barbara, who's been amazing, sending resources in the chat all throughout the session. Just make sure to check that as well for more things. So I think that's all I had. Cindy, anything else?
No, other than I know you're a cat person, Steph, and Amy's got a brand new kitten. She showed me. Anyway, thanks all. Be sure and fill out the evaluation so we can offer more trainings like these in the future. So there she is, the non-named kitten so far. Yeah, take care, everyone. Have a great, I saw somebody's hand up, but Mark, you put it down. All right, everyone, have a great afternoon. Great seeing you. Thanks, Amy.
Bye-bye.
Thank you. I can't remember your name.